I would like to welcome all of you to our KASYP webinar series on SARS-CoV-19. Today we will look at the situation of the youth in Asia amongst the pandemic. I'm very happy to greet both the participants here in the Zoom room, which consists of former participants, alumni of our Konrad-Adenauer School for Young Politicians, as well as the audience on Facebook Live. I think we all went through the different stages of COVID together so far, from the shock, from the experience of the lockdown, the discussion, of course, about the reopening of the economies in Asia, but also in Europe. But what we see now is a shift of a focus where we look more towards questions of how COVID-19 affects poverty, how it affects certain vulnerable groups, women, but of course also youth. And I'm very happy that we were able to bring together established speakers today to give us an insight into the question of how COVID-19 will affect the youth and what needs to be done from a political point of view in order to ease the situation. So I'm very happy to have Lesley Cordero from the Philippines with us today. I'm very happy to have Rhea Penaflor from the Philippines with us today, Shah Ali Farhad from Bangladesh, and of course Chris Pereira from our office in Japan, as well as Dr. Arya Sanjuta from Indonesia. All of them are alumni or are affiliated with the KASYP program, and it makes me very proud to see where this program has come. Last year, we have celebrated the 10th year anniversary of KASYP, and of course, we had a lot of ideas what we could do with the alumni together for this year, for the 11th year of KASYP. COVID-19 has put a stop to us meeting in person, but I'm very happy that we were able to bring together this webinar today in order to have a conversation with each other, to catch up with each other. And so I really would like to thank you for following our invitation to join this program. I would also like to thank the team here at the Office of Konrad-Adenauer Foundation in Singapore, led by Ray Pardit, who is our program manager for KASYP, and he's supported today by Rubia, by Kismet, and by Rita, who take care of the technological requirements and the Facebook Live. So thank you to the whole team. I hope we will have an informative and also instructive 1.5 hours ahead, and I would like to open the floor for the discussion. Thank you very much.
Thank you so much, Christian, for that warm welcome and for launching our first KASYP webinar series. And this is really indeed the first effort of the KASYP program to connect to our stakeholders, especially the alumni, at the same time to non-KASYP, since we are live. So on Facebook, then our followers, at the same time supporters of the Political Dialogue Asia program, can also engage with us. So with this topic on the impact of the SARS-CoV-2 pandemic among the youth in Asia, it was not that difficult to find a keynote speaker who really is an expert in terms of the topic of disaster, and at the same time the topic on the youth. So our keynote speaker is the senior disaster management specialist at the World Bank. But before she joined the World Bank as a senior disaster management specialist, she actually worked as undersecretary of the Philippine government, who managed the recovery from the Super Typhoon Haiyan in 2013 to around 2015 or 2016. So she really has a ground experience in terms of managing disasters. And I think with the situation, it would be the same, more or less, with only different with the nature of the disaster. And not only that she is an expert and have experienced, ground experience on disaster management, She has been the former commissioner of the National Youth Commission in the Philippines also. So I think this background, this experience of our keynote speaker is just perfect in addressing the topic on the impact of SARS-CoV-2 pandemic, which I would say is also a disaster of maybe beyond the magnitude of Super Typhoon Haiyan that impacted the Philippines, but at the same time an expert on the issues that are being faced by the youth, especially here in the Philippines and maybe in Asia. So without further ado, I would like to introduce to you our keynote speaker, Attorney Lesley Cordero.
Thank you so much, Ray and Christian. Can you hear me now? All good?
Yes, we can hear you now.
Okay. It's a privilege to be a part of this conversation and being in the midst of young political leaders, people working in government, in various organizations. It makes me nervous because I think a lot of people here have a lot to share also. But what I realized when I got the invitation is that it's an opportunity also to see where we are at in terms of the agenda of young people in the midst of this pandemic. So my title is Finding the Youth in Between the Demographics. And initially, I just plugged in the title in all white. And Ray comes back to me and says, send us your slide because we want to change it because we can't find and we cannot see the title clearly because it was done in white. And my purpose was to highlight the point that in the midst of all the issues, the noise, as well as the struggle to be able to provide a proper response and recovery approach, we are losing the young people. So we need to find them in between the demographics so that we will be able to respond properly. But the next slide would show you what are the impacts of COVID-19 pandemic among young people, specifically in the education sector. And we are talking about 90% of the world's students, 1.5 billion young people in 188 countries, and over 60 million teachers who are kept away from schools and universities. Talking about this large-scale interruption, it leads to several issues: the limited healthcare access, increased dropout rates, depriving young people of the social support that they badly needed. We're also talking about disruption to education, causing delays in graduation, and conversely, checking and impacting the ability of young people to graduate on time, as well as find the proper employment. We're also talking about young people with no regular or affordable internet access falling behind because now everyone is transitioning to an area where online platforms and shifting learning and participation that way. But what this whole situation is highlighting is that distance learning is highlighting the driver of existing inequities. Less than 40% of low-income countries announce distance learning education programs versus 90% in high-income countries. The challenge of technology, as well as materials and staff complement that are equipped to do this, is driving home the point that you can see the imbalance of richer and poorer countries trying to make do with whatever they have in coping with the situation and education. The next slide would highlight also the impact of COVID in employment. The International Labor Organization said that young people are 3 times more likely to be unemployed than the adults. We are economically fragile, lesser savings, as well as most young people are engaged in the informal sector. And we all know that the informal sector is the first to go in this kind of lockdown and closure of businesses and economies. But in their report in 2019, ILO has highlighted that the unemployment rate increased by 13.6%. You are looking at around 267 million young people who are not in the need. This is not in employment, education, and training. And out of that, 77% of employed young people are holding informal jobs. And the other portion of around 126 million are considered in extreme or moderate working poor globally. So they have limited access to healthcare, social services, social protection, and other things that are badly needed by the young people. This whole COVID situation also affects the quality and quantity of jobs because most young people are engaged in the service sector performing manual routine jobs. So you can see a lot of young people being forced to do and go out even if the situation is not yet stable and comfortable because they need to earn a day for a payday's exchange. And then we're also talking about a World Bank report that says that 1 billion young people would enter the labor market in the next decade. But out of that 1 billion, only 400 million would find a job. And this impending recession will only increase the uncertainty of the prospects of the remaining 600 million. So the challenge now is, what can we do to address this impact? Is there a better way of improving the numbers that we are looking at right now? In your respective countries, is there a chance where we can find a demographics for young people and be able to provide an equitable and a responsive solution to address this? The next slide would highlight the career aspect. How does this whole pandemic impacting our careers as young professionals and as young people? Of course, the doctors, the nurses, they're front and center. But impact-wise, they are putting their lives on the line because every day the chance of getting affected as well as getting the proper healthcare is there. Delays in career growth and promotions for lawyers, bankers, accountants, challenges on taking a pay cut because that's all the enterprise or the business or the company can afford. There's also that need to shift careers, finding ways to reinvent ourselves because of the limited opportunities that's out there. And the most challenging also is the need to upskill, retool, as well as diversify in terms of possible careers. There was a survey done around 500 or less young entrepreneurs by the United Nations Development Program as well as City Foundation. And they were asking the question, how has the pandemic affected young entrepreneurs? And they're saying that 86% are negatively affected based on their business. 88% had reduced customer demand, supply chain disruptions, as well as eventual closures of businesses. And there's also a decrease in the financial returns. Others had to dig deep and borrow or reach into their savings. And eventually, 25% had to postpone their investments. For people who are thinking of opportunities to reinvent themselves, like if you're working in a company, having your career, waiting for a promotion, maybe this pandemic is also asking us to rethink and explore possible enterprises or businesses. But again, this is the numbers that have been shown based on the March to, I think, June data. Across the different sectors, enterprises in consumer products, tourism, arts, events, and hospitality sectors are most negatively impacted. But enterprises in technology, telecommunications, and education sectors are not experiencing the same negative impact. So if you are to choose now which of these enterprises to go into or which line of industry we can try to transition, these are some of the things that you can look at. The next slide would also show you the impact on our social life, young people's social life. Because of the strict lockdown and the guidelines on quarantines, we have limited gatherings, events, sports, highlights of culture, arts, performances, concerts, and conferences, they're out the window. And it will take a longer time for governments as well as organizations to go back into this kind of setup. There's also some patterns changing in the way we go to the malls, the movie theaters, galleries, travels and vacations, going clubbing, coffee shops, hang out, or having just dinner and lunches with friends in restaurants. These things have to be revisited, and there is a new way of doing these things. And the trends, of course, more and more you are seeing digital meetups, meetings being conducted like this Zoom. And then, of course, you're celebrating and doing parties through Zoom. Social media organizing is coming front and center. And then, of course, online dating is increasing. Civic space may contract. Freedoms of assembly, privacy, and expression will be affected because this is no longer the face-to-face, flesh-to-flesh that people are so used to. The handshaking is out the window. So we need to find better ways in trying to encourage people to still voice out, still campaign, and still do what they need to do to protect these freedoms. And then the restrictions on movement also hamper the ability to mobilize and support communities, knowing that people in the communities would need to see us face-to-face or as well as presence on the ground. So these are things that we need to rethink how we will do it, and then to test and also modify, improve along the way. But the next slide would show you that there are several factors that influence coping mechanisms among the youth in times of crisis. Access to positive coping mechanisms such as social initiatives, community service, formal or non-formal education, the sports activities, or other types of physical activities. It's all the positive aspect of having somebody sharing a conversation and being embraced or being felt. Flip side, also the impact of being isolated from this social support results to negative coping mechanisms. The toxic trio, as they call it, is addiction, mental health issues, and domestic abuse. We can see a lot of people turning into drugs, alcohol, just to cope with their frustration, their anger, their anxiety, and their fear. But in the study, we are seeing that 84% of young people are worse with their mental health problems after the school closures. And this is simply because the schools that usually provide them with access to mental health support, psychologists, or even having just friends around is taken away from them. That's why there's an increase in this mental health issues. Access to social media, digital technology, and other platforms to communicate and connect and express is getting a huge bump because people are finding ways to just connect and talk to other people using technology. Youth organizations also and young people or leaders are trying to take matters into their own hands as a way of coping. You can see a lot of youth organizations supporting communities to combat the pandemic, as well as help people recover faster, recover better, and then start building back their lives. You're talking about fighting misinformation, mobilizing community action, developing innovative products and services. And of course, for our young politicians and people working in government and civic society organizations, more and more you are doing things to be able to support and move the needle. The next slide would show you that there are other aspects of coping mechanisms. Vice Media did a global survey of around, I think, slightly less than 3,000 young people from ages 16 to 44 in Asia and the Pacific. And the finding was that 62% of young people are looking to family and friends as their number one way of staying grounded throughout the pandemic. Social media is just second. And then, of course, all the financing and finances issue at 43%. In the study, they also highlighted that memes and humor is a #1 element that helps young people get through the outbreak, even higher than news updates and daily tips and advice. Regardless of where you are, which country you belong, or which organization you are affiliated, you always go back to finding some funny stuff in the internet and finding these memes to make you laugh even in the midst of this crisis. But what is important is also to understand what type of content young people want during the pandemic. When this was asked in the survey, they found out that 68% wanted personal stories of people overcoming the coronavirus. That feeling of empathy, as well as assurance that you can beat the virus. And then 49% said uplifting, inspirational, and humorous stories. 46% finance management, and the rest is just about home entertainment. The next slide asks the question, what is the perception of young people about their post-pandemic future, and how are they preparing for it? So in the same survey, young people across Asia and the Pacific are feeling more hopeful than their counterparts in the other region. What is scary about this whole situation is that young people are feeling less convinced that everyone is doing their part to limit the spread of the virus. So young people are growing less trusting, even if they are hopeful. So you have 43% in Asia who are hopeful versus the global number of 36%. And lowest in the ranking is the feeling of uncertainty and empathy. These are the predominant emotions, but calmness and happiness is the lowest. So uncertainty and empathy is the highest emotion, and then calmness and happiness is lowest, as we all know. The next slide would also show that in the long term, when asked, how do you feel and what is the impact of COVID-19 pandemic? 50% of the youth in Asia says there is a positive impact out of this. But the other 50 is also saying that mostly it is negative. But what is crucial about this study is that you can see that young people are also worried and anticipating the major societal shifts. 64% thinks that there is a way that the way that our economy is operating will change. The way the public engages with the community is also changing. And 56% is saying that the way the public socializes and the way that we also work will also change. What is crucial is that understanding now who we call as the lockdown generation, trying to define the new normal and redefining ways of doing things. I think there is the best opportunity to start tinkering and thinking, what are the things that we can do better? How can we get out of this situation and manage the situation? It levels the playing field because it's not just about who is in position, who is older, who is richer, and who is in control. Because right now, everyone is grasping with straws in how to deal and address the situation, not just on the health part, but also the social aspect, the infrastructure aspect, the business and economy, as well as the other institutional arrangement that needs to be revisited. So now is the best time to be able to think, rethink, as well as find that flexibility to be able to check what are the things that we can do better. And you can see in the pictures that a lot of people are adjusting in the way meetings are being conducted. The shaking of hands, the greetings, and later on, when we go back to our respective offices, the way we do airline travel and our vacations, that will also change. So this is the best opportunity where we can encourage people, young politicians as well as leaders of youth organizations, to redefine the ways of doing things as we help our respective countries, our respective governments prepare and recover, and eventually find that level of resilience to be able to power through however long this whole pandemic will last. Next slide is something that I want to speak to, the search for the invisible youth. I understand that everyone in your respective organizations, governments, as well as countries are doing everything you can, trying to deliver, trying to address the situation best way you can with whatever information that is put forward before you. But the realization throughout this whole lockdown and being part of government before, sitting in meetings, is that during pandemics, crisis, emergencies, and disasters, I couldn't find where the youth is. Not in terms of responding, but in terms of the conversation, in terms of the discussion in high-level cabinet meetings. And rightfully so, because in the confusion, the chaos, and the wanting to respond to a pandemic, a disaster, or a crisis, there are other competing priorities and other far more important issues. So how do we find the youth in between the demographics? Always, I find myself looking and asking, how are we addressing the young people who are affected by this crisis or this disaster? And the answer is, it is found large in the demographics, and it is a subset of a subset. Meaning, when you look at cross-cutting issues during this pandemic or crisis, you have the vulnerable groups. You're talking about cultural sensitivity. You're talking about gender and social inclusion. You're talking about environmental protection and sustainability, poverty reduction, disaster risk reduction, local governance. And in areas where there is conflict, finding the peace and development angle. And we find the demographics or the numbers of impacted or affected young people in the vulnerable groups. So that's a subset of a subset. So we need to find better ways in looking for the young people so that the issue will emerge and we can find the right approach to respond to these issues and address them. Talking about being lost in the narrative of cross-cutting issues and concerns, I think as I see some of your designations and titles today, it's reassuring to know that in the battle of finding the numbers of the young people and the issues that they are experiencing, you are there at the forefront. And I trust that you will continue asking this question and fighting. But in our search for the invisible youth, I think this is an opportunity for us to redefine the narrative. Sometimes people say that the title that I put forward is provocative, but the reality is it bothers me, it provokes me, it angers me. At the same time, it challenges me to do better. So this is our call and our opportunity to redefine these narratives, to tell our story the best way that we know how. And this is a best opportunity to take me to the next slide, which highlights how we can reimagine our roles and take control. Now is the best time because everyone is trying to grasp at straws to find solutions. So they will start to listen if you give them an opportunity to take you seriously. The bigger circle shows a picture during Typhoon Haiyan. I think this was month 1. After 30 days, the United Nations called for a United Nations humanitarian country team meeting with senior cabinet officials, and ministers of various departments. When you take a closer look, you will find that seated at the table are all people beyond the age of 40. And you can find me at the corner. So the challenge now is, how do we get a seat at the table? How can we find a way so that we can represent? Where you can find young people is at the back, seated, standing, taking notes. But the challenge now is, when you get a seat at the table, start representing and doing whatever you can and finding that window of opportunity to ask, can we consider some of the projects to help young people who are also affected? It is also a challenge to speak up and speak out, because sometimes it is not intentional for the older ministers and the officials to forget the young people. It's just that in the flurry of issues and concerns and in the hierarchy of priorities, sometimes we are at the bottom. So it is our duty to challenge them and to speak out and remind them that we are a good chunk of the voters later on who they will reach out to when election comes. But what is crucial also is to prepare, so that when that right opportunity comes, you will be able to pitch the numbers and share the stories. When they listen, they will hear not just the statistics and the data, but they will also hear the stories on the ground. And this is the best way to make these ministers and these senior officials in government and CEOs of companies and organizations listen. When you have that window of opportunity, it is also good to be able to put forward your ideas and recommendations and not just talk about the issues that the youth are facing or the challenges that you are going through. High time for you to speak up, put forward whatever recommendation you have, and demand that it will be done, and to find also financing to be able to do that. And then, of course, it's crucial to take action and to deliver on whatever recommendations you have. Now where we sit, I think we find ourselves also doing our regular tasks. And our regular tasks or functions do not specifically talk about young people. But it doesn't hurt when they see somebody below 40 sitting at the table and nudging them and saying, maybe this is the best way to do this. And maybe you can explore this because we have done this in other countries. Or a colleague from KASYP mentioned that they're doing it in Bangladesh, in Pakistan, in Myanmar. These are some of the examples that would help us. And it's nice to know that you are among peers who are going through the same thing, addressing the same challenges, and finding also some hope that you are doing something right in your other country, and you can help also by sharing your experiences. Let me share before I close an experience that I had. This was, I think, around February 28, 15 days before the Philippines declared a strict lockdown or enhanced community quarantine. And we were at the Department of Finance. I have a project. It was a loan for $500 million for the Philippine government. It was specifically for disaster risk management, and it had several support to various agencies, including the Department of Social Welfare and Development. And during these negotiations, going line by line throughout the loan agreement, it was reassuring, comforting to know that seated across me at that table was the Assistant Secretary of DSWD, Asek Peñaflor, a fellow KASYPer. I rested easy knowing that when I pushed something specifically on how their department would be able to help communities and young people address disasters as well as crisis, she has taken it to heart. And having the same principle, the same values, it's nice to know that you have a friendly face across the table. And fast forward, when government needed that 500 million disbursed, it wasn't as difficult to push because she was also there at the other side to push it. So chances are you will encounter your friends, fellow KASYPers, in future meetings and negotiations, and you know that you're in good hands because everyone went through the same program that we went through from batch 1 to batch 10. On this note, thank you very much for this opportunity to be a part of this conversation. Thank you.
Thank you so much, Lesley, for, I would say, a very comprehensive presentation on the impact of the COVID-19 pandemic among the youth in Asia that covers from the thematic, or from the topic on education to employment, to career, to social life, and of course, discussing the coping mechanisms and the responses, which is, I think, it's a good point because the plan for the next session of the KASYP webinar is to really discuss and explore what are these coping mechanisms or responses among the youth to really address the situation. And I think this is also a good, I mean, your ending, I would say, is a good way to call for action among the youth on what we can do. Not just from the, I would say, the busy days of responding to specific disasters or trying to provide our warm bodies to different efforts, but really to question the kind of significant role that we can play in governments, in our communities, in our societies. So I think it's a very apt way of ending your presentation, the call for action among us, so we can also try to reflect on what would be the best way to be involved in this pandemic. And of course, not only that, we heard a good input from Lesley, I would say general impressions or general information about the impact of COVID-19 pandemic, but it would also be interesting to really look at specific country cases. In this case, we were fortunate to be able to invite some alumni who are, I would say, at the forefront in addressing the situation or being involved in responding. So the first panel speaker or panel discussant that we have is Dr. Arya Sanjuta. He is the Executive Director of the Indonesian Democracy Initiative. He will be speaking about the situation in Indonesia and maybe a situation in Southeast Asia. And of course, Dr. Arya will be the second panelist, and our first panelist will be Mr. Shah Ali Farhad. He is currently the Special Assistant to the Prime Minister of at the Prime Minister's Office, Republic of Bangladesh. So I believe that his position would really give us a lot of ground experience on how a young leader is helping plan the government's response to COVID-19. And the last speaker or last panelist that we have, we are fortunate to be joined by our Senior Program Manager at the Regional Program Social Economic Policies of the Konrad-Adenauer-Stiftung in Japan. So I believe that being in Japan, and Japan has been, I would say, at the forefront of the news in how they battle COVID-19. So I guess the inputs from Cristita will be very relevant in understanding how the Japanese youth are also coping with the situation. So the sequence would be, we start with Shah Ali Farhad, and then we continue with Arya, and then we continue, we end the panel discussion with Cristita. So right now, I would like to introduce Dr. Arya Sanjuta to talk about the impact of, Shah Ali Farhad to talk about the impact of COVID-19 among the youth, especially in Bangladesh, or if possible, the impact of the COVID-19 among the countries in South Asia.
Thank you, Ray, and good afternoon from Dhaka to all the fellow members of the KASYP and other participants joining in this discussion. as well as anyone who might be watching through the Facebook Live. Before I start with the issue of youth in Bangladesh and COVID-19, let me just give you a brief, very brief overview of the situation regarding COVID-19 health-wise in Bangladesh right now. So the first case of COVID-19 in Bangladesh was detected on the 8th of March 2020. And since then, we still are in the middle of this fight against this novel coronavirus. We have had around 122,660 confirmed cases till yesterday. And among those confirmed cases, we have had, unfortunately, 1,582 people who have died. Around half of the people who have been infected so far have already recovered fully, and the rest are in various stages of recovery, either in institutional quarantine, isolation, or at home, being isolated from their families. And also there are some who are in a much critical stage and being hospitalized with emergency support. So that's the facts and figures regarding the status of COVID-19 in Bangladesh right now. Bangladesh, as you probably know, is a very young country, not only in terms of its coming into existence in 1971, but it's a young country in terms of the people here. So around 60% of our population are under the age of 40. So demographically, it's a very young country. And one of the positives that we have had because of this young population is that the death rate in Bangladesh has been low compared to many countries, especially the countries in Europe who have had a predominantly aging population. But this is a double-edged sword. The fact that we have more youth means that we have also more youth who did get infected and are getting infected. So let me just give you a few stats. So from the first 2 months, that means till the end of, around the end of May, 26% of all infected persons were between the age of 21 and 30 years. Around 24% of all infected cases were of people who are in the age range of 31 to 40. And 8% of them are around the age of 11 to 20. So if you take that all into account, more than 58% of the infected cases are actually among the youth and the adolescent population. In terms of fatality, in terms of the death rate, 87% of the people who have died fall between the age of 51 to 60 and above 60 years of age. Only 7% of those who are aged 31 to 40% have died from the infection. The challenges that the youth of Bangladesh are facing in terms of the COVID-19 are not very different from what has already been mentioned by Lesley in her very well articulated presentation. The unemployment created by the COVID-19 and the lockdowns that were in place. Just let me give you a brief overview. From March 26, Bangladesh went into a general holiday, and that persisted until the end of May. Right now, we are at a customized lockdown stage where we are not imposing any general stay-at-home orders, but only those areas which have been most highly infected have been under lockdown orders. And according to a survey of the International Labour Organization, ILO, 1 in 6 young people in Bangladesh have already lost their employment or are at risk of losing their employment due to the restricted economic activities in the last 3 months in this country. Those who are still employed, around 23% of them have their working hours cut. So these are the stats from the International Labour Organization. It should be noted that young women, compared to young men, are more at risk of being unemployed or already have become unemployed. This needs to be taken into account with the other negative impact that the COVID-19 situation has had on the economy of Bangladesh, including that our economic growth, while we are still targeting over 8% economic growth in this fiscal year, which is just about to end on the 30th of June, there is a lot of reports from the international organizations like the World Bank and the Asian Development Bank and the IMF that this might not be a realistic number, and there would be some 2 to 4% of the GDP growth rate would be slashed by the restricted economic activities. a lot of Bangladeshi youths go abroad as migrant workers, especially in the Middle Eastern countries. Till now, we have data that around 1.4 million of these migrant workers have lost their jobs, and these are mostly youth, so those who are under the age of 40, for example. Average income of families have also dropped significantly, depending on which international organizations report you see. 50 to 74% of income has been slashed during this time of an average family. The impact has not only on the employment of youth, but also on the education and skills of the youth as well. So due to the COVID-19, since March 17, all the educational institutions in Bangladesh have remained closed. Right now, the government is going to keep the educational institutions closed till the first week of August, with the possibility that this may be extended further. So what is happening during this time is that many private schools and universities are conducting their classes virtually through Zoom or other platforms. Public schools, which is the largest school structure in Bangladesh with the government funding, they are also carrying out their lessons to the young children with to the help of national TV. So it's not really an online learning session, but a multimedia learning session where the national TV, which is free for all, they are every day telecasting the lessons that the kids were supposed to learn at school. Public universities, unfortunately, are not conducting any kind of academic activities at the moment. They remain fully closed. But the private universities, maybe not all of them, but most of them are conducting online classes. So, as I said, a large economic impact has been felt by Bangladesh due to this crisis, and the government, to offset the impact, has already announced various stimulus packages worth around 11.7 billion US dollars. 2 weeks back, Bangladesh announced its next budget. That means the budget for the coming fiscal year, which will start on July 1st, and it is a $66.8 billion budget. And both the budget and the stimulus packages both have various incentives and packages which are directed at the youth. So, but this year's budget mostly looks at the allocations for the important sectors like the health sector. So we have a 23% increase in healthcare for the next coming fiscal year, which is around 3.4 billion US dollars. And plus there is also $117.3 million special emergency package for responding to COVID-19 challenges. We have also increased our budget for the social security sector. A lot of new poor are being feared to have developed in Bangladesh over the last 2.5 months, according to one report by the Bangladesh Institute of Development Studies. Around 16.4 million new poor will emerge from this crisis. And this is still a speculative number because we have not fully recovered from the crisis. It's still an ongoing one. The social security budget has been increased by 16.83%, and most of them are directed at the ultra poor and the new poor, and will respond through mechanisms like food aid as well as cash handouts. Just last month, the Prime Minister of Bangladesh announced and implemented a policy of increasing the number of people who receive cash incentives by around 5 million people. And the total social security package that has been announced in the budget includes 10 million more beneficiaries than what used to be done previously. Going straight into some of the matters concerning the youth, one of the incentive packages announced by the Prime Minister includes one which gives soft and collateral-free loans to youth who have lost their jobs. It is a $23.4 million package, as well as the Ministry of Youth and Sports is taking up another mega project of $821.2 million US dollars for creating youth entrepreneurs. The target is to create 1.2 million new youth entrepreneurs, making them self-employed. There is also the challenge of skills development. So the fact that the existing programs that we had for skills development needs to be modified because we are going through an unprecedented economic crisis, not only in Bangladesh, but globally. What kind of skills would be required at this stage to make the youth employable for the coming months and years would need to be rethought and redesigned, and the government is doing that. Currently, we have around 14 skills development projects which are being undertaken. 7 of them are being funded by the World Bank itself. 2 of the most key ministries of the government in terms of skills development of youth are the Information and Communications Technology Ministry, as well as the Ministry of Youth and Sports, and as well as the Education Ministry. And all these ministries are currently redesigning their skills development programs in order to take into account these new realities. Now, Lesley very rightly pointed out the mental health of the youth in terms of the unprecedented restrictions that they have been subjected to in the last 2.5, 3 months all over the world, not only in Bangladesh. And definitely there is some form, although we do not have a specific survey or report as yet on the impact of the COVID-19 crisis on the mental health of youth, but we have whatever international organizations, research organizations, and think tanks in Bangladesh do work with the youth. They have pointed out some of the impact that this crisis has had on the youth. So, for example, the anxiety regarding getting infected is something that persists. There is also the fact that most of the young and adolescent populations are currently at home, not having to attend their educational institutions. There is also the problem that everyone else is facing, that they are not being able to socialize with their friends and loved ones outdoors, outside their homes. There is also the worries about uncertainty regarding their future, not only in terms of the education and employment of themselves, but also the general outlook of the country. What will happen to the country in 6 months' time? What will happen after 2 years? So there is also that worry and anxiety that the youth are feeling. But I must tell you that in terms of the courage that has been shown by the youth of Bangladesh, it surpassed my expectations. I mean, some of the best voluntary work in Bangladesh in the last 3 months have been actually done by youth-led organizations. So the political party that I belong to, Bangladesh Awami League, has a very large student organization called the Bangladesh Students League. So the Bangladesh Students League has been praised in the last 3 months for doing some very difficult voluntary work. So, for example, we have had a shortage of agricultural farmers during the harvesting season. And what this boys and girls from the student organization, what they did was they went to different parts of the country and helped the farmers harvest their crops, as well as they have been doing extremely good voluntary work in terms of getting food aid to the people who need them, as well as operating these free vegetable markets. And the most amazing part is that for a significant amount of time, there has been a disinformation and miscommunication about what happens to people who have died of COVID-19. And there have been instances where families were reluctant to accept the dead bodies from the hospitals, and where the administration was facing trouble and problems regarding burying them or doing their cremation. And you have these youth organizations like the Students League coming into the forefront and actually, properly wear PPEs and then helping with the families with the cremation or burial or the funerals, etc. So they have surpassed the expectations, the youth of Bangladesh, in terms of this crisis and the way that they have responded to that crisis. But of course, the whole saga, despite their excellent work, makes us worried about their long-term mental well-being. And I think some of the pledges that we had made as a party before the election now becomes that much more important. So in 2019, our party announced that we will be opening a mental health facility in every district of the country. And where a district does not have a mental health facility, we will be increasing funding for private institutions who offer mental health and counseling. I think in the current situation, that pledge becomes that much more important, and I'm quite confident that the Prime Minister will take that into account in this current year and make sure that our government has enough resources at hand to look after the mental well-being through counseling of the youth. What also we are trying to do from the government side is we are trying to have a targeted social media campaign to reach the youth and give them messages of hope and optimism that despite the challenges at hand, the difficult times that we are facing, we will overcome this by coming together and doing what is necessary. So right now, you have targeted campaigns regarding the health guidelines that we have to follow, because right now we are not under a lockdown, but infection still persists. So we have around 3,000 to 3,500 people getting infected every day, and that is just the number among the people who are being tested. So this could be more. So this is not going away anytime soon. We can't put a time limit on it, like 40 or 50 days. We will try our best, but we also need to prepare the youth and the population of the country in order to make sure that they're ready for the challenges that we need to overcome. And we have to overcome them by taking all together. And I think the most important role in this regard has to be played by the youth, not only in terms of the support we provide to the youth, but the way the youth respond to these challenges. And by the indications that I've seen in the last 3 months, I'm quite confident that the youth of Bangladesh will do whatever is necessary to make sure that happens. So that's it from me for the time being. If you have any questions, I'll be happy to answer those.
Thank you so much, Shah Ali Farhad, for providing us a very insightful presentation about the situation of the youth in Bangladesh. And I think it really helps when we have someone who is working at the Prime Minister's office to really give us good information about how the youth or how the government is responding, at the same time how they're engaging the youth. And I would like to point the discussion when you said that the youth are being involved in the agriculture, and it is very interesting, a situation where you have youth who seems to be more about modern, I would say modern type of employment or modern engagements, technology-driven engagements. But with this situation, it's I think very interesting and very hopeful to see or to know that with the pandemic and the youth actually are helping in this sector, which I would say they are also needed. So thank you again for the presentation about Bangladesh, and we can proceed to our next panelist who can discuss about the situation, especially in Indonesia, and maybe he can also share about the situation in general in Southeast Asia. So the next panelist is Dr. Arya Sanjuta, who is the Executive Director of the Indonesian Democracy Initiative.
Can I share a slide?
Yes,
Yeah.
Arya, you can share the slide.
Okay. Can you allow
Arya,
me?
we have 10 minutes for the panel presentation.
Can you open the share? Padit, Ray Padit?
Is it okay now?
Yeah. Okay.
You can share now.
Okay. Okay. So this one. Okay. Okay. Thank you, Christian, King Ray, and all the committee from KASYP. Thank you very much, all the fellows of KASYP. Good afternoon, all. I miss you all, especially my batchmate, Faisal, Rhea, and other fellows. So I will very fast to talk on the impact of the SARS-CoV-2 or COVID-19 pandemic among the youth in Asia, especially
Sorry, Arya,
in
I'm sorry.
Indonesian case. Yep. Yeah.
I think you have to double click so you can share the screen.
See? Can it? Okay. Okay. And in Indonesian case and Southeast Asia case, then I will start with the thing that mentioned by Lesley. Very good. If Lesley said that humor is one of the element can helps young people to get through this outbreak of COVID-19. So I will start with some element that helps the young people in Indonesia or maybe in some Southeast Asian countries to get through. For example, in Indonesia, the government facing the dilemma between the economics situation that very suffer between economic situation and healthcare issues. So one of the steps that taken by the government is they choose a good spokesperson for the COVID-19. So some critics say it is a policy to cover the incompetency of government to tackling the COVID-19 pandemic in the country. But some positive thought also say this is especially some of the young people said this is a good step, so the community will always pay attention to watch TV for waiting for the spokesperson to do a daily briefing. Yeah, this is a young, yeah, we talk about the young people who taking role in this situation. Young celebrity doctor. His name is Dr. Raisa, a doctor who are also doctor who are model. So, other element that helps, as we know, yeah, as we know, had that toll in the region in Southeast Asia with 200. Far south. Other element that I'll start with the Southeast Asian countries respond. That's a condition of the Southeast Asian countries, and so we have 10 countries with 10 different responses, 10 different approaches. But some general trends we can say most of the countries maybe except some country like Singapore who are really go far on and very success in flattening the curve and tackling any situation of the COVID-19. Some of general trends is lack of testing, and there are also inconsistent policies and the low capacity on healthcare facilities and so on. You can say like that. But maybe we can take Singapore as an example. They are really lead in some approaches, like they implement the prompt and chip approach and very strong in hospital oriented based approach. And in terms of the public information, they deliver very transparent and try to engage the participation of the citizens and society. So and even though they are very transparent, they also keep the secrecy very cautious. So they using also the cautious approach. And we know Singapore is very well known with the circuit breaker approach. Then I will start to talk about the impact of COVID-19 for social life. So the social life, employment, and education. In social life, yeah, this is also one of some elements that helps young people through the outbreak of COVID-19. Other than seeing a good-looking spokesperson, maybe this is one of the facts. This is not a joke, but it is a fact. Yeah. So the pregnancy in Indonesia increase faster than even faster than the COVID-19 positive case. So not only the national media news reported, but also the New York Times even reported Indonesia's new coronavirus concern a post-pandemic baby boom. So maybe under the lockdown situation, no entertainment, and also restricted mobility and limited activity, then most of the young people family, especially young couple, choosing their own way or using an element to entertain themselves. Okay, but on the flip side, there is also a stressful condition. So very stressful condition, because it is the situation is hit very hard to the economic situation. So when some young men or young people in the street is being rebuked by maybe by the police or by the apparatus while they're hanging out, then they stab the chairman of the pillars of the leader to death. So also there are also a fact that the criminal is increased under this situation. So impact to the education, I think the previous presentation already mentioned there are various conditions of the society. For example, in Indonesia, not all of the citizens have a good access to internet. Then not all of them is very fast in adjusting the model of learning from home and the online home online study. So this is a figure that proves. And impact, as Lesley also already specific data for Indonesia, there is around 3.05 million is work termination and laid off workers. And for the social life, as I mentioned before, there is a phenomenon of big increase in pregnancy. More than 400,000 pregnancy happen, and we are waiting for the baby boom post-pandemic era, while the economic growth is very suffer. And how the young people coping and preparing pandemic COVID-19. So this is one of the analysis about the mega shifting of consumer behaviors that happen in Indonesia, or maybe we can take a similar example from other countries. So the people is consuming more vitamin or more preferring more than the other drinks. So there is a trend. The espresso or coffee is substituted by the traditional drinking. So some of the business coffee shop is try to modify it, not only selling coffee but also a traditional drink. And the future of traveling also in several days there is a media analysis found that the hashtag of when we travel again is at the #1 top trending topics in Twitter. So yeah, the future of traveling, I think, is still open, but still have to waiting for some times. And online homeschooling. The policy school from home in Indonesia is follows by two trends. The first is the online schooling that using the digital platform, and the second is the parent itself also start to learning something new. So when the online schooling started, then the parents also start to learning to join to teaching their own children. So homeschooling is being one of the trends here, online homeschooling. And telemedicine from visit to virtual, this is also one of the trends that shifted in this situation. And also the rise of empathetic society and solidarity among the society, especially the youth. So most of the youth is now, there is a survey, is more prefer to both something from the neighbors than but both from online that place in far away from their home. So there is a movement to prioritize their neighbors than the citizens that are quite far from their home. So, and also virtual concert is in many places because the situation, and frozen food also part of the new trend. We can say the new normal of business for small enterprise, and even the big restaurant also. Some of them is shifted the menu from the dine-in menu to frozen food menu that sell through online. Then a subscription model matters. What I mean with subscription model matters is like grocery through online and film and music via online, or maybe food that sell via online, and study from online games. Those all increase in this situation, including the sport from online. So my last message is, I think this is I taken from one of the governor in West Java, who's saying a very specific message to young people. So he said, Ridwan Kamil, his name is Ridwan Kamil. Let's keep fight COVID and protect our loved one with 3 rules. First is wear mask and use love when meeting with your loved one. The second is keep your distance, but please keep close your heart guarded with your loved ones. Then the third is wash your hands and wash away your dark past. This is some example to bring the sense what happened in Indonesia, especially when we talk about what kind of words and language that used by the policymaker to engage the young people or young community to collaborate with the government to tackling the COVID-19 situation that very hard happen in Indonesia. I think that's all for my session. Thank you.
Thank you so much, Dr. Arya, for, I would say, really tapping on the idea of using humor to cope with the situation. I think the idea that now Indonesia is actually the top one in terms of population growth in the region in Southeast Asia. And with this presentation, then I think that top one was still maintained by the country. So it may be difficult for the rest to follow. But of course, that's something that is a double burden or a double, I would say, meaning for the country in terms of providing good quality education, healthcare, and employment for, I would say, the new perceived baby boom or after this COVID-19. So I guess we can observe that there are a lot of similarities from the presentation of Shah and of Dr. Arya. So looking at Bangladesh at the same time, an in-depth presentation on Indonesia. So these two countries being part of the developing economies, I would say that this is expected to learn that there are similarities of experiences in terms of the impact of COVID-19 among the youth in terms of education, employment, career, social life. So we are interested, I think it's equally interesting to listen to the next speaker who is coming from, I would say, a developed economy, Japan. And let's see if these experiences will be the same or will be different among the youth, among the Japanese youth. So we are privileged enough to have the senior program manager of the social economic policies or SOPAS of the Konrad-Adenauer-Stiftung Japan office. We have Ms. Cristita Perez to give us insights on the experience of the Japanese youth with this situation.
Hi, everyone. Can you hear me? So I would like to share my slides now, and hopefully you can see it. Okay, so although I'm currently living in a developed country, I originally come from the Philippines and I've been here in Japan for close to 3 years now. So I'm still in a way navigating the Japanese world. So I limit my discussion to the impact of COVID-19 to young people in Japan instead of covering the entire East Asia sub-region. So I've divided my presentation into 6 short parts. I'll start by providing Japan's economic and demographic outlook, contextualizing COVID-19's impact on the several aspects of Japanese daily life. Then I'll provide a brief assessment of COVID-19's impact on the following areas. First, we have employment. Then you have education, you have public life, mental health, and lastly, political leadership. So I'll start with giving the context. So this is how Japan's population pyramid looked like in the 1960s. So it resembled a standard-shaped pyramid with a broad base. However, the shape has changed dramatically as both the birth rate and the death rate have declined over the years. So at present, a majority of the Japanese population is between the age of 15 to 16, while the aged population, 65 years old and over, constitute 27.8%. So the annual population growth rate is also expected to continue to decline into negative territory in the next few years. So the data shows that the aging society in Japan is progressing quite rapidly compared to other Asian countries and even the other European countries. So Japan's economic situation is likely to remain severe for the time being due to the impact of COVID-19 domestically and abroad. So consumption is likely to remain weak because of COVID-19 and the decline in oil prices. So analysts have already warned that the economy will contract to 20% in this quarter, second quarter of the year, far exceeding what the country has experienced during the 2008 financial crisis or the Lehman shock. Let's go now to employment. So the virus is ravaging the labor market. So businesses bear the brunt of the damage as corporate bankruptcies and layoffs have increased due to the pandemic. But in the labor market, opportunities are limited and competition is very fierce. So this is especially damaging to fresh university graduates who are entering a disrupted labor market during uncertain times. So in Japan, initial labor market conditions, in particular, when workers first enter the labor market after permanently leaving school, have a significant lasting impact on the employment experiences of workers in their teens or in their early 20s. So an increase in the unemployment rate at the time of the labor market entry actually reduces the probability of gaining full-time regular employment. And more important, increases the future probability of workers of leaving employers by lowering the quality of job matches. So meanwhile, those who are employed are also cautiously trying telework or this work from home arrangements. So the government has been trying for years to encourage firms to implement flexible working patterns, hoping that the less demanding office hours will help women to return to work after having children and men to share some more housework and childcare. But the uptake has been really slow. So experts say that a part of the challenge is the social stigma attached to deviating from this salaryman archetype. The stereotype of a suited up office worker who proves his dedication by spending really long hours at his desk. So, but experts said that being forced to try teleworking is likely to have a lasting impact in Japan, with companies beginning to see working from home as a feasible and even attractive option. So commuting times are cut, time spent with families is increased, managers are seeing teleworking as a management strategy tool. And in some households, the share of housework done by males has also increased, which is always a good thing. So on education, the Abe government decided in the last months to provide up to 200,000 yen. So that's roughly equivalent to 1,900 US dollars in cash handout to each of around 430,000 university and other students in the nation who are struggling financially to pay for tuition and living costs amidst the spread of the coronavirus. So students from overseas are also eligible for the program, but students have criticized this program, arguing that it should cover more of them and that tuition fees should be reduced. So the government has also set an additional criterion for foreign students hoping to receive the cash handouts. So in addition to those that you have to prove that you are struggling financially, if you are a foreign student, you also have to be in the top 30% of the class to be eligible. So while schools and universities, another point that I'd like to make is that while schools and universities across Japan have largely tried their hands at distance learning over the past months, significant discrepancies have emerged between private schools and public schools in particular. So many private schools in Japan were prepared, and then they transitioned to distance learning quite quickly. However, public schools generally seem to not have been able to cope at all. So it was something that they didn't really anticipate. So digital education technology has largely remained a backup plan for many of the educators, but especially in Japan, they really lag behind most of the developed world when it comes to adapting technology to meet the needs of the modern classroom. So we go now to the next slide, which is on public life. So Japan was put under the state of emergency in April of this year. So, but the measure, unlike in other countries who are doing lockdowns or community quarantines, the state of emergency in Japan is only made possible by a recent amendment to the law against infectious diseases. So this only empowered governors of designated hotspot prefectures to strongly request citizens and private businesses to practice social distancing, such as minimizing outings, working from home, and closing or reducing hours of businesses. But there are no enforcement provisions. There are no enforcement provisions such as fines, and the lack of enforcement provisions invited skepticism. So analysts argue that the Abe government staked the success of social distancing on young people. So mobile data research from the 2 weekends prior to the state of emergency, so this was late March, they showed that the youths are showing a greater reduction in their mobility. And the worst non-compliance with a call for social distancing actually belongs to those who are over 60. So the senior citizens were more hard-headed compared to the young people in responding to the Abe government's call to stay at home. But the restrictions in the daily life of the citizens has taken a toll on how the Japanese viewed freedom or their perception of freedom. So a recent survey found out that the estimated degree of freedom in people's daily life in Japan is about half the level it was prior to the COVID-19 pandemic. So they feel less free in daily life. So let's go to mental health. Japan is among the highest countries in the world where among the countries in the world where there's a high rate of suicide. So here, Health Ministry statistics actually showed that the suicides in April fell nearly to 20% from a year earlier. This is in a way countering widespread concerns that the pandemic would drive many to take their lives. But officials and experts warn that there might be a resurgence. So despite last April's figure, they say that the fact remains that the fallout from COVID-19 is taking a toll on the livelihoods and mental health of many across the region, depriving them of jobs and increasing the risk of domestic violence and even child abuse. So further exacerbating the situation is the fact that many of the suicide prevention groups in the country are finding themselves on the verge of dysfunction after being forced to either downsize or suspend their activities due to the virus. So my last point would be on political leadership. So in the screen that you see, these are not actors on a Japanese drama. On the left actually is on your, wait. One of them is the governor of Hokkaido and the other is the governor of Osaka. So the governor of Hokkaido, Suzuki Naomichi, and the governor of Osaka, Yoshimura Hirofumi, have been in the public spotlight. So the COVID-19 pandemic has also focused the nation's attention on the prefectural governors in charge of spearheading the local responses to the crisis. So these two governors are leading the response in two of the hotspots of COVID-19 here in the country. So in particular, these governors have been in the public spotlight because their prompt action influenced the subsequent response of the central government, and that made their names known throughout Japan. So I think I'm limited to only 10 minutes, so I'll stop my presentation just by discussing the impact of COVID-19 to the Japanese youth, but there's no time yet to discuss the details of the coping mechanisms and how the new normal will look like, but I hope that we will have that time to share during the open forum. So thank you for listening, everyone.
Thank you so much, Cristita. And I really like how you ended your presentation, giving us the idea of how youth are actually taking actions, especially young leaders, young political leaders in Japan. And I think this phenomenon is not only limited to Japan, but I think I can see and observe other countries where young leaders are really stepping up in their role in addressing COVID-19 or this pandemic. So maybe there is something within young leaders that makes them or make them very capable or very flexible or agile in addressing this kind of a situation. So again, I would like to thank all our speakers for giving us their time and especially their knowledge about the situation in Asia, or let's say in the specific countries represented by the speakers. So to Lesley for giving us an overview of the impact of COVID-19 in the region, and then to Shah for giving us an in-depth presentation about the impact of the COVID-19 among the youth in Bangladesh. Same with Arya, the situation in Indonesia, and of course, for Chris for presenting the situation in Japan. So we have Christian here also, and we would like to open the floor for discussion. So I would like to request everyone to open their video now, so we can see who have questions for the panel and the keynote speaker. I would like to inform you that unfortunately, due to the time limitation, maybe we can extend for a maximum of 10 to 15 minutes. So I would like to request everyone to raise their question, I would say concise and brief questions for the speakers. So please use the reaction button below for those who have questions, and I will take 3 questions from the participants, and please indicate if your question is directed to one specific speaker. Of course, for those our followers and supporters of our Facebook page, you're also allowed or we would be very happy to take your questions. Please write your questions in the comment box, and we will try to answer as many questions as possible. And for the rest of the participants now in Zoom meeting, you can also raise your questions through the chat box. So anyone who would like to start, so you can please click the reaction button. So we have one, Rhea. Anyone else? Okay, so we start with Rhea.
Good afternoon again. It was very interesting discussion from our panelists and of course, Attorney Lesley Cordero. My question is for Shah Ali, Farhad of Bangladesh. I'd like to know if the government, your government has already reimposed the lockdown as I have read in the news and in your government site that you would like to reimpose the lockdown. And so what's the reason for this? Thank you, Shah Ali.
Ray, how much time do we have for each answer?
If possible, maximum of 2 minutes.
All right. Thank you, Ria, for your question. From the 26th of March till the end of May, we have had a complete countrywide general holiday. We don't call it lockdown, we call it general holiday stay-at-home order, except for emergency services. Everyone else had to stay home. And apart from groceries, everything else, pharmacies and groceries, everything else was closed as well. But since the 1st of June, we have had a resumption of economic activities on a limited scale. Right now, we are in that experimental phase where we are looking at the impact that the withdrawal of the general holiday has had on the health situation and the COVID-19 infection situation in Bangladesh. But what we are doing right now is we have identified, with the help of information technology and the medical data, areas which are considered to be very high risks in terms of the patients and the population that they have in those areas. So all over the country, there is no general holiday, but we are designating each area as a red, yellow, or green zone. And depending on the zoning system, The red zones, only that area falls under the general holiday scheme. And currently 45 areas around Bangladesh, including one area in the capital city Dhaka, is under that zonal lockdown system. And although there are some calls for a countrywide lockdown to ensure for a month more, but given the economic realities that we have had in the last 2.5 months, that is something that the government cannot simply entertain at this point. And we are moving towards the zoning system as a much more viable alternative for a developing country like Bangladesh, because we have to appreciate that in a country like Bangladesh, sometimes public health and living or the earnings of people are both matters of life and death. So whenever there is a 1% increase in poverty, there is a proportionate increase in the amount of suicides, for example. So in keeping in mind that reality, we have moved away from that countrywide lockdown system and moved towards a much more relaxed lockdown system based on zones and the limited resumption of economic activities.
Did I get that the number that you gave earlier was that your government is giving 5 million for 5 million people in Bangladesh cash assistance, or like a sort of social amelioration program? Is that correct? 5 million individuals.
Yes. So what the Bangladesh already had a very comprehensive social security package under the current government. So it was 5 million before, and more 5 million have been added to this scheme. So right now it's 10 million people who are under this cash assistance and food assistance program. And in terms of the food aid that we supplied on an ad hoc basis for the last 2.5 months, in order to look after the low income and the low middle income groups of the country during the lockdown, we have had 60 million people receiving food aid and more than 45 million people who received cash handouts. And the 10 million people that I mentioned is something that we will do every month from now on till the situation improves.
How much is the cash assistance that you give for each individual for the 10 million people?
Yeah, it's 2,500 taka, which is around, I think it should not be more than $35 to $40.
Thank you very much, Shah. I'm very interested because we also have the Department of Social Welfare and Development is also implementing the social amelioration program, and we'd like to also learn on how the other countries do it in the respective countries. So thank you for the answers.
I will send you more details, Ria.
Yes, so I think beyond this webinar, it would be interesting that you can also reach out to your alumni KASYPers to really discuss in details about the efforts and learn from each other. So maybe anyone else from the participants who would like to raise questions to our speakers?
Yeah, Ray.
Maybe Christian, do you have speakers?
Ray, I monitored the stream also on Facebook Live, and there was one question that I would probably read out from Nishal Pandey, heading the Center for South Asian Studies in Nepal. And he asked, or he commented during Lesley's input, and he said, you spoke about skill development for self-employment. This is an excellent opportunity. However, at a time when businesses are closed, which job areas are going to be useful for them for skill development? Is that something you could answer on, Lesley?
Yes. So very good and interesting question. I think right now, aside from working on recovery program for helping government of the Philippines, we're also looking at some of the industries. So for example, talking about the tourism industry, and we all know that this is very challenging. We don't know when it will come back, but we are helping some of the entrepreneurs and business operators in that sector to be able to rethink what are some of their new propositions. And then say, for example, if you are a resort, can you transform it into a restaurant that does delivery? So trying to modify some of these engagements and focus on things that are currently needed. We're looking at delivery services for food, for goods, and other things. In terms of technology platforms, developing platforms where people can interact, and also developing sessions for alternative learning. This is very helpful in terms of education, because some of the public schools are thinking of ways to be able to address this, and government has limited staff complement as well as financing capacity to be able to address this. So this is a good opportunity where private sector can also come in. And then aspect of upgrading local infrastructure to also inject job generation in some of these towns, provinces, and cities. These are some opportunities that they can look at, new ways of doing construction, helping deliver or implement some of these projects that were delayed.
Thank you so much, Lesley. Anyone else from the panel speakers you would like to add on the specific skills that should be developed, considering that the self-employment approach or option is an opportunity for our youth now? Yes, Shah?
Yeah, I'd just like to add that as I was saying in my speech, that a lot of the programs of skills development are being redesigned in Bangladesh at the moment. And we have had a report from organization I used to work with, the Center for Research and Information, which has highlighted some of the areas where Bangladesh needs to focus in terms of skills development for job creation in the future. I think it would be very society specific what kind of skills would be required in the coming days. So for Bangladesh, for instance, agriculture, food security would be a big issue. So if you want young educated people to come into farming, come into agriculture, you need to give them training on those. So it's not usually an area where educated youth venture into, but this would be a good time to help them, give them the knowledge and the know-how, and to bring them under this particular sector, which is never going to fall short of demand, which is always going to be in demand, because we will always need food and it will never run out of demand. And apart from that, the information technology part of Bangladesh, that is a place where we would be concentrating more. It is something that we have been prioritizing for the last 10 years. So freelancing and other information technology jobs are something that is a good opportunity for youth, not only as a primary employment option, but also as a secondary employment option. So someone who is doing something else can do a bit of freelancing on the side while they are going through this tough time. So this is also where skills would be prioritized in Bangladesh. But as I said, it would depend on the society we are speaking of, rather than there would be general guidelines for what could happen to youths generally throughout Asia. So we'll need to focus very much on the countries themselves and do proper needs assessment, and then devise the programs, rather than just rolling out programs without the proper background check.
All right, thank you so much, Shah, for that interesting answer. And yes, I agree that the context is very important on what kind of skills to be developed among the youth. So I also saw Nengyim raise his hand, and Patrick. So I would like to ask Nengyim to deliver his question, and then next would be Patrick.
Yeah, good afternoon. I'm Nengyim from Cambodia, but I'm now living in Australia. After the ruling party dissolved my respective parties, CNRP, in 2017. And today I'm happy to meet our alumni in KASYP program, and all the information you share are very critical and good to know. And I'm so surprised to hear from our speaker from Bangladesh that in Bangladesh have so far have a new pool about 16.4 million. And I think the COVID-19 still continue on, still going on. I would ask you a question, raise a question to you that what is your estimate to the end of this year about the economic crisis and the Bangladesh people going to be more and more poor, and how the Bangladesh government prepare to solve and help more poor people go on. And the second question to Bangladesh speaker too, do you know what is the expected GDP for 2020? I think our speaker from Indonesia, from Japan also mentioned about economic growth is going down a lot in Indonesia and in Japan. And I also wish to put this question to our speaker from Indonesia and from Japan too. I think you mentioned the economic growth in Indonesia is going down about -4.8 to -7. It's really a big amount. What I'm listening and follow your presentation, if I'm not wrong. And the question is, what is the government strategy to recover the economy? I think if you can share, we can learn from each other to share some strategy from each government to recover the economy in each country. Thank you.
Thank you, Aningim. So I would like just to summarize the questions raised. One is to Shah Ali Farhad on the, I would say, the estimate of the going down, and then maybe the prospect of your economic growth for 2020. I think the rest of the speakers also, if you can give some estimates on the expected economic growth next year, and maybe like a specific or one specific strategy on how your economies or your countries or the countries where you are in are trying to cope, or the strategies they have to apply to counter this, I would say, the problem with the economic growth. So we can start with Shah.
Yes, thank you for this question. Bangladesh has had a very good economic growth for the last 10 years. For the last 5 years, it has been over 7% GDP growth rate, and as well as for the last 2 financial years, we have had over 8% GDP growth rate. And as a result of which the per capita income has risen, poverty rate has come down. But till February of this fiscal year, and the fiscal year ends in the end of June, till February of this particular fiscal year, we have had a very strong run. But since March, the impact has been felt on economic activities, and definitely this will have an impact on the ultimate economic growth that we see at the end of June 30. Now, the government, the finance ministry has said that we will have a over 8% economic growth. I am not in complete agreement with that. I think the growth has, for the next financial year, has been set at 8%. And this particular year, it would be around 5.2%. Now, achieving 8% economic growth over the next fiscal year is an ambitious target, but I think that the reason why the government has put the target forward is to make sure that we strive to get as much possible as close to the target rather than, starting off with a low target point. But definitely, we have had around 2 to 4% of our GDP being affected by the current crisis in the current financial year. We will have the exact figure, the official confirmed figure of GDP growth at the end of this fiscal year. So sometime during the first 2 weeks of July, we will be able to tell you that. And you asked another question about how long do we think that this crisis will go on, because this is still going on. It's a very difficult question to answer. We still have around 3,500 to 4,000 cases of infections being detected per day. There is no such thing as a peak in the number of cases in Bangladesh per se. We haven't been able to do that, but we are hoping that by the end of this year, at least by the end of this year, that would be not a very optimistic viewpoint, but I am very much realistic when it comes to figures like this. So it's impossible to say that something like this would be over very soon. So say a month or 2 months. So I'm giving it 6 months. So it's a very personal figure. It's not something that the government has provided, but I personally think it would need at least 5 to 6 months for us to, bring the infections down to a level where we can say that it is now completely manageable and will have no impact on the economy. And that is also important for the first question, because the longer the crisis continues, the public health crisis continues, the more depressing the economic outlook would become for the next financial year.
All right, thank you so much, Shah. So any estimates from Japan and Indonesia too?
Japan first, or?
Yes, you can give an estimate, Arya. What's the economic growth for next year? And that's
the pandemic for Indonesia. I think the minimum it will be at 2021. So it will be quite long. But when you ask about the economic situation and the combination between economic situation and the COVID-19 pandemic in Indonesia, I would answer with this scenario. Can you see? Yeah. Okay. So the scenario is, if you look the Y, yeah, the Y axis is about the economy. So we need the combination between economy strategy and global cooperation. This is for Indonesian case. I don't know about other. What I mean is, when we suffer under the economic recession, but at that time we still can maintain our global cooperation, we will enter the scenario of global aid. It means maybe the situation is very bad in terms of economy, but we can still survive with the global aid. Like what happens now, some of the healthcare facilities or the equipment of healthcare, personal protective equipment is coming from other countries. But when we facing the deep recession in economy, but we cannot maintain our global cooperation, we suffer in this scenario, uncontrolled pandemic. It means we can take a case like Italy. See, like Italy, they suffer in terms of economy, and when they propose help from the European Union, they cannot afford they didn't get any help. Then they trap in the scenario of uncontrolled pandemic. This scenario is very bad. So this one is something that we should avoid. But if we got a V shape, like a strong economic growth after the recession of economy, maybe next year, but we cannot maintain the global cooperation, then we trap into the scenario of resources war, because when the vaccine is found, then the next question is, do we get access to the vaccine with the good price and other and for the ideal scenario is when we have a strong growth economy, it means we got a V shape in economy, then we combine with the global cooperation, then we got a global solidarity. It means we can we can, recover from the situation, from the global COVID-19 pandemic, and also recovering from the economic situation. So for Indonesia, I think we are now under scenario global 8. The economic is still not so good, potential to be under recession, but our close partnership with many countries can be some factors that could help us to survive until next year, then going up to facing a V shape, I think, like that.
All right, thank you so much, Arya. I hope the Indonesia will move from the second quadrant to the first quadrant, so the rest of Southeast Asia can also benefit from that global solidarity. So any estimate from Japan, Chris?
All right, the estimates vary. So if, for example, the lower bound of the estimates is at -2%, but the upper bound is at -0.5%. So right now, there are the talks about recovery, for example, is not even dominant in the national conversation. What everyone is trying to do is to contain the economic fallout from the virus. So the Abe government has issued a fiscal stimulus amounting to around 117 trillion 117 trillion yen. So this might increase, this might double to around 200 trillion yen. So that's roughly equivalent to 20 trillion US dollars. And this, a huge chunk of that would be for cash handouts to members, to each member of the household, regardless if you are a Japanese citizen, as long as you're living here in Japan, you get the cash handout. And then part of that would also go to expanding the lending programs. Another part of that would go to moratoriums on tax payments for struggling businesses. So the deficit in the budget, around 23 trillion yen of that, the government would issue bonds to cover the deficit. So there would also be subsidies to proprietors, sole proprietors, to freelancers, and to small and medium enterprises. And there would be another part of that will go to the local governments. And another part of that would be to stockpile the flu drug, Avigan, so that Japan can increase its production. So that is, I think, the key containment strategies that the Japanese government is doing right now to cushion the economic fallout from COVID-19.
All right, thank you so much, Chris. Unfortunately, due to our time limitation, I can only entertain two last questions. One is from Patrick, and the other one is from Raman, but we also have questions on our Facebook from Elaine and Fermac. Unfortunately, I don't want to appear a biased host because most of these are Filipinos, or the three are Filipinos. So I will send your questions to Chris because it's asking about the suicide rates, and at the same time, the general question of Fermar to the rest of the speakers. So maybe we can start with Patrick, and then we end with Ramran. So please deliver your question. You're very concise and brief. Yes, Patrick?
Yeah, thank you, Ray, and thank you to all the speakers. Good afternoon also. My question is focused on the informal sector, particularly the working youth in the informal sector. So, you know, anecdotal evidences says that COVID-19 and the lockdowns has really affected or impacted the vulnerable youth, or those young people also in the informal sector, like those micro entrepreneurs, construction workers, even bus drivers, migrant workers also, and even street vendors. So my question to everyone, especially to the four speakers, is that I would like to know on what are the specific social safety net programs aside from skills development that the World Bank is trying to work right now with the different affected countries in Asia. And even maybe perhaps Chris also when it comes to Japan, because Japan is a donor country. And then for Bangladesh and Indonesia, what are the specific social policy programs of the government to protect and help young people in the informal sector be protected from this impact and be able to recover also from the pandemic and those social and economic impact that they have, given that you have very limited resources also in government?
Thank you, Patrick. So the question of Patrick is more on social policies to address the informal sectors, especially the youth who are dependent on the sector. So maybe before you answer the questions, Ramran, maybe you can deliver your...
Before you, I also wanted to know the World Bank program. So not only social policy, but social safety net programs also.
All right. Ramran, what is your question for the speakers?
Hello? Can you hear
Yes,
me?
we can hear you now.
Hello?
Yes,
Hello?
we can hear you, Ramran.
Yeah, my question is go to Lesley, and because of he's working with bank, so that I want to know that hello? Hello?
Go ahead.
Go on.
Can you hear me?
We can hear you.
Hello?
Okay, Ramran, maybe you can type your question on the chat
Can you hear me?
box. And yes, we can hear you.
Yeah, my question is go to Lesley because of she's working with World Bank, so I want to know during this epidemic the COVID-19 what is the role of World Bank, and then what kind of financial support and maybe technical support are they providing? That is a very short question. And second one, what I see is that now because she also working on the youth in Asia, right? I want to know the role of ASEAN government. So far, I don't see that the ASEAN government is some kind of show their collaboration on fighting COVID-19, because of now what we're doing is every countries they have to do by their own. It's not. I don't see that some kind of among the ASEAN government some kind of collaboration. So in what factor do you see on that one, what kind of maybe some kind of I would say that some kind of problem or some kind of what other thing that you will see why they don't show that collaboration on this kind of during this very health crisis?
All right, thank you, Ramran. So
yeah, that is my question.
Thank you. I will now give the floor to our speakers to answer the questions of Patrick and at the same time of Ramran. And I would like to request our speakers also to maybe at the end of your answers to give your, I would say, last note before we end this webinar.
Okay, thank you. Yeah.
Anyone who would like to start?
I'll start, Ray.
All right.
Okay. I'll answer the question of Trick first. One is, what is the World Bank doing? There are several, based on the needs of the countries, several social protection packages that the bank is supporting. So quickly now, for the Philippines, we are helping the Department of Social Welfare and Development, either a top-up of the conditional cash transfer, just a fresh injection of money, so that that money can also be used to top up the additional assistance that is being given to the affected people. If I'm correct, I think we're looking at 23 million people that is being assisted by the Department of Social Welfare and Development. The other safety nets or social protection programs is that there's no specific for the informal sector, because for the youth in the informal sector, simply because I go back to my title. What is the number of the young people engaged in this, and finding again the youth in the demographics? What you will see, and I think Arya will confirm, is that different governments are lumping the youth together either in the vulnerable sector or in the household assistance. And there is also another lump where assistance to micro, small, and medium enterprises. So the World Bank financing is helping support those programs of government. The other thing we are doing is providing technical assistance and technical support to the staff complement of government as they develop their policies and guidelines. We all know that everyone is caught in this shock, and the pandemic has leveled the playing field because no one was prepared enough. So World Bank is trying to find ways to quickly modify and help government respond to the situation by scaling up or scaling out some of the existing programs and then plugging in money to help support that. If we want to define the interventions for this youth in the informal sector who are affected, crucial to find the numbers first, see what are the issues so that government can respond properly. And that is a challenge that we can give to the academe, to civil society organizations who can help government identify. On the question of Ramran in terms of what World Bank is doing in other countries, how we are helping, the bank is providing cash injection by providing, let's say, development policy loans that go through budget to support various governments as they finance their response and recovery interventions. Second, we are also providing policy advice as well as technical support to complement the different loans that we have provided. And then, of course, in terms of projects, helping in building the capacity of the government officials as well as the technical people in government as they start implementing. But what is crucial here is the quickness of the response and helping government think through based on their specific issues and contexts, what are the appropriate solutions. At the end of the day, the bank is just supporting and governments all over the world are taking the lead. Also bringing together a pool of various countries to share experiences. So every Thursday in the evening, we have this webinar where we invite different local governments, different cities and provinces to share experiences, how they are coping with COVID, what are their challenges, and how they can improve. So peer-to-peer learning. And then on the question on ASEAN, I had an opportunity to be invited in a high-level policy dialogue for ASEAN. And in the ASEAN currently, the discussion is supposed to be a one ASEAN response. And you are right, Ramran, in highlighting that it feels like each country in Asia or in Southeast Asia is just doing their own thing. And right now, I understand that ASEAN is trying to put together and strengthen that mechanism. Same goes every time there is a major disaster, whether it's a typhoon, it's an earthquake, they are trying to find a way to intervene as one ASEAN, putting in place that disaster response center, they call AHA Center. I think it's in Indonesia, Jakarta. But the challenge has always been, how do you now bring everyone to the table as they are busy responding on their own? So they have to find that sweet spot where their comparative advantage and value addition is being felt. And I think the main sector or main area that can be a good entry point is disaster response as well as crisis management. So it's something that's not so controversial. It's something that is needed and the impact can easily be felt. So I hope that I've answered the questions. In terms of a closing statement, truly a privilege to be a part of this conversation. And I continue to encourage everyone as you do your own function in your government, in your companies, as well as organizations, to help in your own little way to find that youth in between the demographics. And if we practice that, hopefully 5 years from now, 10 years from now, the title will not be the same. Thank you very much. Truly a privilege to be a part of this dialogue.
Thank you, Lesley. Maybe we can proceed with Shah, your short answer to the question, and then your short closing, of course.
Thank you. So social security, let's start with some brief stats about the informal sector in Bangladesh. Around 85% of our working population is actually employed in the informal sector, like many of the other developing countries around the world. And the total employed population in Bangladesh, according to the last labor survey, which is around 2.5 years old, according to that survey, the total employed population is 61 million. So 85% of that being in the informal sector represents a very significant amount. And according to one of the economic think tanks in Bangladesh, they came out with a report last month that around 20 million of those employed in the informal sector have already been temporarily unemployed as a result of the decreased or restricted economic activities over the last 3 months in Bangladesh. So it has hit the people working in the informal sector very hard. And as I was mentioning in my speech, that the emergency food aid and the emergency cash assistance program that the Bangladesh government implemented in the last 3 months were primarily directed at the people who have lost their livelihood as a result of the stay-at-home orders, basically working in the informal sector. So we are talking about people who were riding rickshaws, who were working in roadside tea stalls or other shops, those who were day laborers working in the construction industry, which employs a large number of informal sector workers, all of them becoming temporarily unemployed, as a result of which the government implemented a 3-month-long program, and it is still in some instances going on, whereby food aid was delivered in the form of rice to more than 60 million people. In Bangladesh, it is 6 crore people received that food aid over the 2.5 months of emergency assistance. Also, more than 4.5 million, I mixed up the million and the crore in Bangladesh. So that would be, the 6 crore would be 60 million people received the food aid over the last 3 months. And it has been done in phases throughout the country, not only in any particular area. Apart from that, the general social security regime in Bangladesh is also quite extensive. It has been expanding exponentially over the last 11 years, according to what we have developed is the National Social Security Strategy 2015. Under that, we have 145 programs dealing with social security, social safety net for the low, middle income and marginalized sections of the society. In the current budget, this allocation has been increased to 11.2 billion for social security, which is 16.8% of our total budget and 3% of our GDP. This increased allocation means that we would be able to add 1 million more beneficiaries under the existing programs, not only the emergency programs. And apart from that, the cash assistance program that Patrick asked about. So the emergency assistance program under the existing framework, apart from COVID, used to be 7.5 million people who receives food aid under ordinary circumstances. That number has been raised to 2.5 million because 5 million more beneficiaries have been added as a result of the COVID crisis. This aid is delivered to what is called the ration card, or it's a particular support card that the government gives you, and by showing that, you can buy food at a very rationed rate. So 10 taka per kg rice, which is usually much more than that, 4 or 5 times more than that. And this is restricted for the low income and low middle income population. Apart from that, we have another feeding program called the Vulnerable Group Development, under which around 2.5 million people are given food aid. So this is a continuing structure. And for the informal sector, to be honest, industry-wise, we will have to come up with more solutions. So for example, people who lost out on their jobs in the construction sector, which employs a very large number of people, we will probably need to figure out particular incentives to the construction sector in order to make sure that those who were temporarily unemployed can be re-employed. but that would ultimately also depend on the overall economic situation. So if growth falls, if economic activities comes to a standstill, if the earnings of people are not recuperated, then it is impossible for any government to continue such emergency food and cash assistance to such a large number of people for a prolonged period of time. So hopefully the global and the national situation in Bangladesh and across the world would get better. We can only hope for that, and we do not have any other option to hope otherwise, because in a developing country like Bangladesh, lives and livelihood are both matters of life and death. And it is something that the government is struggling with. The lockdown issue, for example, taking it off was not an easy one for us to do, but we had to do that because the government knows that it simply cannot continue these programs for an indefinite period of time. So I hope that we can pool our resources. International cooperation has always been important, but I think it has achieved a greater significance in this time of crisis, especially in countries in South and Southeast Asia, East Asia. I think Asia as a whole needs to come together, and the relatively prosperous nations in this region must stand by those who are finding it much more difficult than them in coping with these challenges. I think that's my take for the time being. Thank you for inviting me today.
Thank
and it
you
was
so much.
really a pleasure to hear you all, and especially the panelists who know much more about these topics than I do.
Thank you so much, Shah. So now we proceed to Arya. Very short answer at the same time, your last note, so we can also finish this webinar.
Okay, so the first priority of the government of Indonesia is life sustaining. So, but there is a problem, big problem, when we see the fiscal capacity of the government. So that's why the government is only focused on several provinces that became an epicenter of COVID-19 pandemic, such as Jakarta, West Java, Central Java, East Java, mostly in Java Island. And what the government do is delivering the basic universal needs like rice each month, like rice, oil, eggs, such things to all the citizens. Other things, the government cannot support all the needs of the society. So the best scenario of the government is try to approach with the civic collaboration approach. We call it like that. So the government opened the platform that invite the private sectors to donate. So and that on that platform, there is a details map which area that hasn't got any support from the government. So from the private sector, they can choose which dot that they want to deliver the support. So the civic collaboration is actually one of option that chosen by our government because of the limitation of the capacity, fiscal capacity for exact. I think so, and thank you for the opportunity for KASYP. I miss you all, KASYP fellows. Thank you.
Thank you so much, Arya. And we proceed to Cristita, I mean.
All right. You sound like my mother when you call me by my full name. Anyway, on Patrick's first question about how Japan is spending its donor money, I don't think I have the expertise to answer that. So I'll pass that message to the Japan International Cooperation Agency, JICA, for the details on the informal sector. But on the informal sector, as the way it is defined here, this means the people who are working on temporary jobs they actually constitute 20% of the working population. So as a cushion for the effects of the pandemic, one of the things that the Abe government did was to transfer cash. So they have decided to give each person 100,000 yen as a direct cash transfer to help cope with the pandemic. So that's around $900 US. The second thing is that everybody here is covered by the national health insurance. So in case that you get sick, you only pay around 30% of the total bill. Part-time workers are also covered with unemployment benefits. But the policy interventions, for example, to secure their jobs, such as increasing the unemployment benefits, for example, or increasing the number of paid leaves, and even reducing the income tax, I don't see that happening in the near future. So I think that right now what the government is doing are just quick band-aid solutions, but from a long-term perspective, it will not solve the situation on the part of the informal and or part-time workers. And last point, Fermar, I will answer your question this Sunday when I will meet you on another webinar. So closing remarks. Thank you, everyone. Thank you, Christian. Thank you, Ray, for inviting me to this particular webinar. It was enjoyable. I also felt the organizers' tense situation in making sure that everything runs smoothly, experiencing being both in front of the camera and behind it. So I think you did a good job. So give yourselves a nice tap in the back, and I hope that everyone will have a nice lunch, dinner, maybe brunch after this seminar. So stay safe and healthy, everyone.
Thank you so much, Cristita. I would like to invite Christian to offer his last notes for this event.
Thank you so much, Ray, and thank you, of course, to all our speakers and also to the audience who asked very insightful questions and took part in the interactions. It was really a nice afternoon for me, I have to say, because it was a throwback to so many wonderful KASYP experiences. So it's really great to see how this idea of the Konrad-Adenauer School of Young Politicians comes to life, especially in a situation like this where we have big challenges, in particular for a young constituency. And I think the examples that were laid out, the best practices that were shared, were definitely helpful for our way forward in the different countries we are active in. So thank you again very much for taking part in this very first KASYP webinar. We will make plans for additional webinars. We will probably try and stick to the time a little bit more next time. But it's really great that you stayed with us for the whole afternoon. And I would like to again thank in particular the team of KAS Singapore, led by Ray, who put so much effort into this webinar. And I hope that I will see you again soon. Thank you so much for joining us today.
All right, thank you so much, Christian. So now I would like to request everyone to open their videos. We would like to take a screenshot, so at least we have some documentation for this first webinar. So I would like to request Shah, Lucas, Lesley, and Kismet to open their videos so we can take a screenshot. Where are they now?
Can you see me now, Ray?
Yes. Shah, are you still there? Kismet?
My video is on.
Kismet is actually... Oh, okay. And Lucas? Anyway, so 1, 2, 3, smile. Finish? All right. So, oh, okay. One more time. 1, 2, 3, smile. All right. Thank you once again. So we would like to request everyone to, you can now turn off and mute your video and audio.
Thank you.
Thank
Thanks
you,
again.
Ray.
Bye.
Thank you. Bye-bye.
Ray,